Good afternoon. This is May 6th, another fine day in paradise. But I wanted to spend a few minutes with you today to give you an update on our clinical recovery, which in my mind, in essence, the question is, how can we recreate the way we practice medicine in the COVID era, and most importantly, how can we do that safely? So a couple things to talk about. One is ancillaries. We haven't heard much about this of late, but just to fill you in, the physical therapy services here at Sutter downstairs and Airway have started to see patients on a limited basis. They are particularly right now working off their backlog of post-operative patients. We have surveyed physical therapists in the community and find that the vast majority of them are now serving patients in person. Our labs continue to remain open all of their usual hours. And lastly, our imaging department, as you all know, has been quite limited in the procedures and imaging that they provide. And they're in the phase right now of making plans to increase their services. All of our ancillaries are going to have to tackle the challenge of how to deal with their situational environments. So all these three areas of ancillary services have small waiting rooms. They have facilities that are tight, and so they have to work out the challenges and logistics of providing social distancing and working on their throughput. So particularly in radiology, it's going to be some time before they ramp up, but they're working hard on solving those problems now, so more to come on that. In terms of the volumes of our encounters, they are slowly trending up. The vast majority of our encounters at this point are video encounters, so it seems like everybody's kind of got the hang of that. Something new as of tomorrow, our patients will be able to self-schedule video visits on MHO, and this is restricted just to primary care at this time. I think we'll be working out the kinks in that project, but the goal will be to roll this out to our specialists in the month of June. And of course, the newest thing is that our ASC is slowly ramping up with some more elective cases. And you should know that all of these moves we're making are perfectly consistent with Governor Newsom's phased recovery, as well as the mandates that have been produced by the California Department of Public Health. Next is safety, and as I've mentioned in the past, safety is probably the most critical factor to regain our clinical recovery because there's this imminent fear in the community. If you look at the press, you can understand why people are fearful to come to our offices. So this is our primary challenge. I did get a chance yesterday to speak with the Press Democrat and talk to them about the initiatives we have undertaken to provide a safe environment. I'm hoping that they can pitch in and help us out with our public. Just to review a few of the initiatives we have taken for you to know, our respiratory clinic has been in process now. We see patients 7 days a week. We were the first respiratory clinic here in Sonoma County. We teamed up with Public Health and started seeing patients, of course, in their car, providing safe COVID tests. We've now tested over 1,200 people. But probably more important than that is that the respiratory clinic has allowed us to divert all acutely ill patients away from our other care centers, and I think that's been very significant. Of course, in all of our care centers, you guys are fully aware that we've limited visitors. When patients and visitors do arrive, they are screened for COVID symptoms, they are screened for a fever, and then of course must wear a mask at all times, and of course these similar rules apply to us. So I hope with the initiatives that you and I and all of us feel safe while we're practicing medicine, because if we don't feel safe, then it's going to be hard to convince our public that we're safe. And I hope that you all contribute to ensuring that we are providing safe care. So if you do see any kind of gaps in our workflows or any gaps in our policies, please do mention that. I think with this structure that we've put in place, we should be able to reassure our patients and allow them to come back when it is necessary to see them in person. I do want to note that of the combined foundation staff and SMUGR providers, you have about 600 people. And of those 600 people over the last several months, not a single one has converted and become infected with COVID locally that we're aware of at this time. So that's quite a testimony to the structure we put into place. And lastly, I just want to recognize what we've been through in the last 2 months with the additional awareness that this is not the first crisis for those of us who live in Sonoma County, but this is number 3. It's been a long a long road. And we've been at this long enough now. I think the adrenaline is probably gone. And with the prolonged nature that's looming in front of us with the COVID crisis, I think it'd be very easy for us, if we don't think about it, to slip into a fatigue state, an exhausted state, and a burnout state. So I appreciate that many of you also have stressors that are perhaps less visible to us. So you probably have extended family in your homes, you have spouses that might be unemployed, you have kids at home, you're trying to homeschool. So we're fully aware that there are a lot of stresses on our lives. So I just want to take the moment to say, make sure we are taking care of ourselves and make sure we are taking care of each other. In my Outlook message I'm sending out today, in my update, I do have a simple link to a UCSF video which talks about self-care for physicians. And I would ask you to, it takes 9 minutes and 25 seconds. I'd ask you to sit down and walk through that. It will redirect your attention back to yourself, provide some hints of things you could do for yourself. We have reconvened our well-being committee, and they will be meeting to sort through. There's a lot of material, a lot of self-help material out there for people like ourselves in the media right now. So we've asked them to kind of digest through that and find some resources that are most appropriate for us. And the last thing I'll say is, remember that we do have an employee assistance program called EAP, which is a confidential counseling service that is part of your benefits. They take care of not only mental health, but they help you with financial difficulties, relationship difficulties, all those things. If you look at my update, you'll find a flyer in there with that information and the phone number to call. So I hope this has been useful. Thank you for your time. Thank you for seeing our patients. And remember to go out and take a walk. Bye.